Hello students, subscribe the Fundamental Pharmacy and press the bell icon for more videos.
Hello students, join our online course for GPAT Niper Drug Inspector to get assured amazing rank.
Hello my dear students, welcome back to the Fundamental Pharmacy. Today we are going to see another classification, that is classification number 32, antifungal drugs or drug treatment of mycosis. This classification is very important for your GPAT Niper Drug Inspector and Government Pharmacist exam. So I would like to request you, please watch this classification until the end. My dear students, we have already seen 31 videos on the classification part. If anybody has not seen those videos, please go in the channel's playlist and watch all the classification videos, because they are very important for your GPAT Niper Drug Inspector Government Pharmacist exam. And believe me, a lot of MCQs they are going to be covered just by watching these videos, because there is a reason behind that. I have not only explained you the classification, but also I have told you some important points which are very important for this exam. My dear students, first of all, you should know what you mean by fungus. As like other microorganisms, so there are bacteria, there are fungus, there are viruses, there are rickettsia, there are protozoa. So most of these microorganisms, they are not harmful to our humans, but few of them will cause very severe diseases. One of them is a fungi. Study of fungus is known as a mycology. Remember, study of fungus is known as a mycology. And infection caused by fungus in the human beings, they are known as a mycosis. So infection caused by fungus known as a mycosis. Study of fungus is known as a mycology. Now infection caused by fungus is a mycosis. Fungal infection or mycosis may be of superficial mycosis. They are caused by ringworms, Candida albicans, Tyriasis vesicular, Tinea nigra. So this ringworm, Candida albicans, Tyriasis vesicular, Tinea nigra, they causes superficial mycosis. मतलब ये superficially infection करेंगे आपके hairs को, nails को या फिर आपके skin को. So superficial mycosis caused by ringworm, Candida albicans, Tyriasis vesicular, Tinea nigra. Now there are certain fungi which can invade to the subcutaneous tissue and cause subcutaneous mycosis. Example, Madura food. Then there, if the mycosis or if the infection of fungus is there in a systemic circulation or blood, known as a systemic mycosis. अगर फंगस ने आपके ब्लड में भी इन्फेक्शन कर दिया तो उसको बोलेंगे सिस्टेमिक माइकोसिस. So systemic mycosis is caused by like histoplasmosis caused by histoplasma. Blastomycosis caused by blastoplasma. Coccidioidomycosis is caused by coccidio fungus, right? So you can see over here again superficial cutaneous or subcutaneous mycosis. If fungus infects your hairs, nails and skins superficially, so that is known as superficial mycosis. If fungus infect hair, nail and skin little bit in a deep, known as a cutaneous mycosis. And if fungus infection is there just below the skin, known as subcutaneous mycosis. Now this is known as superficial cutaneous or subcutaneous mycosis. अगर फंगल इन्फेक्शन आपके वाइटल ऑर्गन्स में है, if there is a fungal infection in the vital organs like brain, lungs, heart, liver, spleen, kidney, known as a deep mycosis. So fungal infection in the brains known as a fungal meningitis. lungs में अगर है, heart में अगर है, liver में है, spleen में है, kidney में है, तो उसको बोलेंगे deep mycosis. Now we'll see the classification of antifungal agents or antifungal drugs according to the site of action. Suppose this one is a fungal cell. This one is a fungal cell and outer line is nothing but the cell wall. Fungal cell wall. Inner line is nothing but the fungal cell membrane. This one is a blue part is cytosol and innermost circle is nothing but the nucleus of fungal cell. So various drugs they act on a various steps. First is nothing but the antifungal drugs which inhibit the cell wall formation of fungal cell. फंगल सेल का सेल वॉल नहीं बने देने वाले कौन से एंटीफंगल ड्रग्स है? Pneumocandins like capsopungin and all that. These drugs they will inhibit the synthesis of cell wall. Pneumocandins or capsopungins and all that, they will inhibit the cell wall synthesis by inhibiting the formation of glycan, beta glycan, which is important component of cell wall. So cell wall synthesis inhibitor, pneumocandins. Second one is cell membrane affecting drug. पॉलिन एंटीबायोटिक्स एंड एजोल एंटीफंगल्स ये क्या करेंगे, ये सेल मेम्ब्रेन को अफेक्ट करते हैं. फॉर एग्जांपल पॉलिन एंटीबायोटिक्स लाइक एम्फोटेरिसिन बी, निस्टेटिन, हैमाइसिन, they what will they do, they will create artificial pores, they will create holes, they will cause leakage of cell content from inside to outside that leads to cell death. तो ये पॉलिन एंटीबायोटिक्स क्या करेंगे, यहाँ पे कुछ छेद कर देंगे, होल कर देंगे, पोर कर देंगे, सो दैट इनसाइड कंटेंट जो है वो बाहर आ जाएगा, फंगल सेल मर जाएगा. सो पॉलिन एंटीबायोटिक्स दे कॉजेस पोर और लीकेज ऑफ सेल कंटेंट. Azole antifungals they also affect the cell membrane. They will bind or they will prevent the synthesis of ergosterol by inhibiting one enzyme known as a 14 alpha synthetase. 14 alpha. So they will prevent conversion of lanosterol to the ergosterol. Ergosterol is a very important component of fungal cell wall. Okay? So they affect the cell membrane. Pollen antibiotics and azoles. क्वेश्चन आता है, इसके ऊपर क्वेश्चन आ चुका है. So amphotericin B will cause leakage of cell membrane, will create a pores, will create a hole. Question आ चुका है. Now again, certain antifungal drugs they affect on the nucleus. For example, first one is a griseofulvin. So griseofulvin will inhibit the mitosis of fungal cell. So it will bind the mitotic spindle and will inhibit the mitosis. तो ये fungal cell का mitosis cell division नहीं होने देगा, right? Now flucytosine is an anti-metabolite which is a product, it is converted into one active metabolite. जो flucytosine जो होता है वो pyrimidine analog है and that is converted into 5-fluorouracil which inhibit the thymidate synthase enzyme and prevent the protein synthesis. So that is a anti-metabolite. Now again you can see this green part is known as a cell wall and this middle is known as cell membrane. Or this purple dot are known as a ergosterol. As I told you, ergosterol क्या होता है, बहुत ही important component होता है fungal cell wall का. So this ergosterol is synthesized from one precursor known as a squalene. Squalene नाम का जो compound है उससे ergosterol बनेगा. See step by step. So squalene is first converted into squalene epoxide by the enzyme squalene epoxidase. Now this step is inhibited by terbinafine and other related antifungal drugs. Now squalene epoxide is converted into lanosterol and finally lanosterol is converted into ergosterol with the help of one enzyme known as a 14 alpha demethylase. Now this enzyme is inhibited by azole antifungals. Azole antifungal जो है myconazole, itraconazole, luliconazole, voriconazole, posaconazole. So they inhibit the 14 alpha demethylase. They will prevent the synthesis of ergosterol. जो azoles antifungals है वो ergosterol बनने नहीं देंगे. Terbinafine and other alkylamines related antifungal they will inhibit the squalene epoxidase. जो pollen antibiotics है they will bind like amphotericin B, they will bind to the ergosterol and will create a pores, will create artificial pores or holes and cause leakage of cell content. जो echinocandins antibiotics होते हैं, echinocandins antifungal होते हैं like fungin, okay, capsopungin and all that. So they will prevent the synthesis of beta glucan. Beta glucan is an important component for bacterial cell wall that is prevented by this capsopungin. So capsopungin and related antibiotics will inhibit the synthesis of beta glucan. Okay. So mechanism of action of antifungal drug. Now we'll see the classification again. As I told you, antifungal drugs they can be classified in a different way. So based upon the chemical structure of antifungal drug. Chemical classification based upon the site of action, systemically used antifungal drugs or topically used antifungal drugs like that. So classification of antifungal drugs they are of different type depending on the mechanism of action, depending upon the site of action, depending upon the chemical structure, depending upon the use, depending upon the. So we are going to see classification in a different way. Classification of antifungal drug. So first class is nothing but the antifungal antibiotics. First class is nothing but the antifungal antibiotics. Now in this class, so antifungal drugs they are classified into different classes. So first class is nothing but the antifungal antibiotics. Second class is nothing but the antimetabolite. Third class is nothing but the azoles. Fourth class is nothing but the alkylamines and fifth class is nothing but the topical antifungal drugs. Now first class antibiotics or antifungal antibiotics. Now in the antifungal antibiotics you have further three classes. First one is a polyene antibiotics. Polyene antibiotics. Now why they are known as a polyene antibiotics? तो ये polyene antibiotics क्यों बोलते हैं इनको? Polyene antifungal agent क्यों बोलते हैं? Because इनके structure में repeated double bonds होते हैं, right? So like alkane, alkene and alkaline. So alkane will have single bond, alkene will have double bond, alkaline will have triple bond. So these polyene antibiotics will have double bonds in the structure. So first drug from polyene is amphotericin B, nystatin and hamycin. So you can remember this by Na, NaH, NaH, Na. N for nystatin, H for hamycin, A for amphotericin B. So they are polyene antibacterial drugs. Now out of that, amphotericin B is a having wide spectrum. Amphotericin B जो है इसका spectrum ज़्यादा होता है. So it is a wide spectrum antifungal antibiotic. It is not given by oral route. It is given by injectable route. Okay, it is an injectable antifungal agent. Now after injection, it causes certain adverse effect. तो जहाँ पे इंजेक्शन देंगे वहाँ पे थ्रोम्बोफ्लेबाइटिस होगा. So thrombophlebitis, chills, fevers, rigors. So due to release of histamine, fever is there, chills are there, pain is there. Adverse effect related to injection. So amphotericin B causes two kind of adverse effect. पहला होता है कि adverse effect is the adverse effect related to injection due to site of injection. So chills, fevers, okay, chill, fever, and then thrombophlebitis. Now adverse effect due to dose. So dose dependent adverse effect. Second होता है dose dependent adverse effect. So in that you have nephrotoxicity, neurotoxicity, nephrotoxicity and neurotoxicity. These are the two main adverse effects. They are dose dependent. Dose dependent adverse effect of amphotericin B can be decreased by using liposomal amphotericin B formulation or by using colloidal amphotericin B formulation or by forming a complex of amphotericin B with the lipids. Remember, dose dependent adverse effect of amphotericin B can be decreased by either forming a liposomal amphotericin B or forming a colloidal amphotericin B or by forming a complex with the lipids, right? Now second, antifungal antibiotics. They are known as echinocandins. Echinocandins, in that you have capsopungin, micafungin and anidulafungin. How to remember these names? Very simple. ये मिका क्या है? मिका इज नथिंग बट द मिका फंगिन. मतलब मिका मतलब क्या है? मिका फंगिन. मिका क्या है कि बॉलीवुड सिंगर है. तो मिका पाजी ने क्या किया? मिका पाजी ने सिंगिंग छोड़ के सीए ज्वाइन कर लिया. सीए. सो मिका ज्वाइन द सीए. सो मिका फॉर मिका फंगिन, सी फॉर कैप्सोफंगिन एंड ए फॉर अनेडुलाफंगिन. तो मिका पाजी ने सिंगिंग छोड़ के सीए ज्वाइन कर लिया, राइट? नाउ थर्ड subcategory in the antifungal antibiotic is nothing but the heterocyclic benzofuran derivative. So in that you have griseofulvin. So griseofulvin is a drug or antifungal drug used for the topical dermatophyta. Now griseofulvin inhibit the spindle formation in the fungal cell and prevent the mitosis of fungal cell. Remember. Now second class in the antifungal agent is nothing but the antimetabolite, that is a flucytosine. So flucytosine क्या है? It is a nothing but the anti-metabolite. Flucytosine is an anti-metabolite. So it is a prodrug. If flucytosine is a prodrug, it is converted into one active metabolite known as a 5-fluorouracil by thymidase enzyme. Now 5-fluorouracil will bind to the DNA, will inhibit the DNA and protein synthesis by inhibiting the thymidase synthesis enzyme. So 5-fluorouracil is the active metabolite of flucytosine, remember. Now third class in the antifungal agents, they are known as azoles antifungals. In that you have two subcategory, imidazole antifungal agents and triazole antifungal agents. Imidazole मतलब क्या? 5-membered heterocyclic ring containing 2 nitrogen, 1 3 nitrogen in a 5-membered ring known as a imidazole. Triazole means 1 3 nitrogens in the ring known as a triazole. In the imidazole I further topically used a drug. In that you have clotrimazole, iconazole, miconazole, clotrimazole, iconazole, miconazole and oxyconazole. So how to remember this? Clotrimazole, iconazole, miconazole and oxyconazole. So ये देखो, मी मतलब क्या? यमाई मतलब मी फॉर माइकोनाजोल. और मी मतलब हिंदी में बोलते हैं उसको मैं, मराठी में मी, हिंदी में मैं. सो मैं बन गया सीईओ, तो आप बन गए सीईओ. मैं फॉर माइकोनाजोल, सी फॉर clotrimazole, E for econazole, and O for oxyconazole. So मैं बन गया CEO. So you can remember topical imidazole antifungal drugs by one trick. मैं बन गया CEO. You can remember this echinocandins by one trick, like Mika ने सिंगिंग छोड़ के CA ज्वाइन कर लिया. सिस्टेमिक के लिए यूज किया जाता है कीटोकोनाजोल इन द सिस्टेमिक इमिडाजोल एंटीफंगल कीटोकोनाजोल. Triazole azole antifungal, in that you have fluconazole, itraconazole, voriconazole, and posaconazole. Fluconazole, itraconazole, voriconazole, posaconazole. Posa, vori, itra, flu. Out of that, itraconazole is the most potent and it is a drug of choice for most of the systemic mycosis. Fluconazole is also drug of choice in the most of the systemic mycosis. After that, fourth class is alkalamine. In that you have terbinafine. So it is nothing but the squalene epoxidase inhibitor. So it will prevent the formation of squalene epoxidase from the squalene. Now topical antifungal agents. So in that you have tolnafate, D-cyclinic acid, then benzoic acid, then cyclopyroxolamine, butenafine, quinidochlor, and sodium thiosulfate. Now how to remember these? You can remember these topical antifungal agents by using one trick. So butane for beta, butenafin for beta satish for sodium thiosulfate. So beta satish Q for quinidochlor, beta satish Q तूने for tolnafate, beta satish Q तूने तेरी बेंज कार से मेरी साइकिल को उड़ा दिया. I will explain this again. बेटा सतीश क्यों तूने तेरी बेंज कार से मेरे साइकिल को उड़ा दिया. How to remember the topical antifungal agents? See, बेटा सतीश क्यों तूने अपनी बेंज कार से मेरी साइकिल को उड़ा दिया. बेटा फॉर ब्यूटेनाफाइन, Q फॉर क्विनोक्लोर, बेटा फॉर ब्यूटेनाफाइन, S फॉर सतीश, बेटा सतीश Q फॉर क्विनोक्लोर, तूने फॉर टोलनाफेट, बेंजोइक एसिड फॉर बेंज कार, साइकिल मतलब सिक्लोपायरोक्सोलामाइन, एंड उड़ा दिया मतलब अंडे साइक्लिनिक एसिड. So you can remember these drugs easily. Now we'll see the next part. Antifungal agent, their mechanism and adverse effect in a very short. Remember, this was a question. Amphotericin B is a polyene antibiotic obtained from Streptomyces nodosus. Remember, याद रखो उसको, Streptomyces nodosus. So it is a polyene antibiotic which create pores in the fungal cell membrane. क्या करता है ये? Pores करता है, which will create a pores or holes in the fungal cell membrane. It binds to the ergosterol and creates a pores in the fungal cell membrane, and that's why leakage of inside cell content and leads to fungal death. So it is a broad spectrum antifungal drug, water insoluble, and that's why it is given by intravenous route. Due to injection or due to intravenous injection, adverse effects like fever, chills, muscle spasm, thrombophlebitis is the adverse effect related to injection due to release of histamine. Now dose dependent adverse effect like renal impairment means nephrotoxicity, neurotoxicity, and anemia due to decreased synthesis of erythropoietin. So these are the dose dependent adverse effects. They can be decreased by forming amphotericin B in a colloidal form or amphotericin B in a liposomal form or amphotericin B complex with the lipids. Amphotericin B, liposomal amphotericin B or colloidal amphotericin B or lipid complex of amphotericin B will decrease the dose dependent adverse effect like neurotoxicity, nephrotoxicity, anemia, right? Polyene antibiotic nystatin is obtained from Streptomyces norisei. Similar mechanism, but it is too toxic to use systemically, so topically easier. Third, griseofulvin, antifungal antibiotic. So it is obtained from Penicillium griseofulvum. Question आ चुका है. Griseofulvin is obtained from Penicillium griseofulvum. So what is the mechanism? It inhibits the mitosis by binding to a microtubular protein in the nucleus and disrupt the mitotic spindle. It is used against the trichophyton, microponosporum, and epidermophyton. So again, this griseofulvin has a poor bioavailability, and that's why to increase the bioavailability of griseofulvin, micronization is done. It is a powerful enzyme inducer, like the action in the alcohol. So alcohol intolerant. Again, next one is a flucytosine. So it is a fluorinated analog of pyrimidine, selectively taken up by the fungal cell, converted into 5-fluorouracil, which inhibit the DNA synthesis proteins. So इसका adverse effect होगा bone marrow suppression, GIT disturbance. Next we will see mechanism of action of amphotericin. Amphotericin will bind to the fungal ergosterol in the cell membrane, will form pores in the cell membrane. There is a leakage of content outside and cell death is there. Again you can see the mechanism of action of azole antifungals. Ergosterol is a very important component of fungal cell wall, which is synthesized from lanosterol. Now azole antifungals, they inhibit the lanosin 14 alpha demethylase enzyme, which is the enzyme important for converting the lanosterol into ergosterol. That is inhibited by azole antifungals. तो लैनोस्टेरॉल कन्वर्जन होता है ergosterol में. ergosterol क्या होता है? इंपॉर्टेंट कंपोनेंट होता है फंगल सेल वॉल का. तो उसका कन्वर्जन कहाँ से बनता है ergosterol? Ergosterol is synthesized from lanosterol. Lanosterol is synthesized from squalene. Okay. So azoles वाले जो antifungal है, they inhibit the lanosin 14 alpha demethylase enzyme and prevent the synthesis of ergosterol. ठीक है. Mechanism important है. So as I told you, a lot of MCQs they are going to be covered just by watching classification videos. Because I have not explained you classification. Also I have explained you drug of choice, important chemical feature, important uses, adverse effect. A lot of questions they are going to cover. Again, azole antifungals, they are known as synthetic antifungal agents. So imidazole and triazole, there are two categories. They are known as a broad spectrum antifungal agents. Triazoles, they are more selective to the fungal ergosterol than imidazole. Okay, they inhibit the 14 alpha demethylase of fungal cytochrome P450 enzyme, which is required for the synthesis of ergosterol. So itraconazole is the most potent drug among this, and is a drug of choice for most of the systemic mycosis. Now terbinafine, synthetic antifungal. Again it is a synthetic antifungal. It inhibits the enzyme required for synthesis of ergosterol in the fungal cell. It causes DHG disturbances. Then pneumocandins or echinocandins. Echinocandins, pneumocandins उसमें सफंगिन वगैरह आएगा. They inhibit the synthesis of glucan polymer. They inhibit the synthesis of glucan. That is a glucose polymer. Okay, glucan, which is important component of cell wall of fungus. Okay. Now we'll see the next part. Again, you can see drug used in the fungal infection. So systemic fungal infection, for example, invasive aspergillosis. Aspergillosis fungus का infection हो गया है. तो drug of choice है आपका amphotericin B. अगर amphotericin B नहीं use कर सकते हो तो itraconazole. So first drug of choice amphotericin B, alternative drug itraconazole. Blastomycosis के लिए भी same. Amphotericin B is a drug of choice and itraconazole is second drug. Candidiasis, systemic candidiasis, fluconazole is a drug of choice. Alternative ketoconazole, amphotericin B or flucytosine. Coccidomycosis, systemic coccidomycosis, amphotericin B is the first drug of choice. Coccidomycosis, amphotericin B, itraconazole and fluconazole, these are the drug of choice. Alternatively ketoconazole. Or cryptococcosis, amphotericin B and plus flucytosine. So flucytosine is used in the combination of amphotericin B. Or alternative drug is itraconazole. For histoplasmosis, amphotericin B, itraconazole. Alternative is the fluconazole. For mucormycosis, drug of choice is a itraconazole. For mucormycosis, drug of choice is itraconazole, and alternatively, or first drug of choice is a amphotericin B. So म्यूकोरमाइकोसिस अभी रिसेंटली ही टर्म आ गया था. जो कोरोना वायरस के पेंडेमिक था उसमें बहुत सारे फिजिशियंस वगैरह ने रेमडेसिविर यूज किया या फिर कोई स्टेरॉइडल ड्रग यूज किया. उसकी वजह से क्या हुआ है, इम्यूनिटी कम हो गई पेशेंट्स की. इम्यूनिटी कम होने के बाद एक सुपर इन्फेक्शन आ गया नोन एज अ म्यूकोरमाइकोसिस. इट इज अ फंगल इन्फेक्शन म्यूकोरमाइकोसिस. सो इन दैट देयर वाज अ drug of choice amphotericin B. Liposomal amphotericin B was a drug of choice. Paracoccidomycosis. In that paracoccidomycosis, fluconazole, itraconazole are the drug of choice. Second drug is amphotericin B. Spirotrichosis. In that amphotericin B is a drug of choice. Second is itraconazole. You can order this magic bullet for GPAT Niper DI Pharmacist exam preparation. Read twice and qualify 100% with very good rank. It's our guarantee. You can contact me on this number. You can see we have very much promising results. Thousands of students they are placed in the Niper by just reading these books. You can also join our GPAT Niper 2024-25 online crash course where you will have live lectures, recorded lectures. All lectures will be subject wise, chapter wise. Study material will be given in the form of hard copy at your address. Online test series will also be there. everything is there in a 8,000 only. And if you get all in rank below 20, your fees will be written in the form of reward.
Hello students, order the magic bullet for GPAT Niper Drug Inspector, read twice and qualify 100